Thank you, Dr. Han and Dr. Lee. I believe you guys have a better understanding on Any-Reach implant system and one-day implant concept, how we can get initial stability with Any-Reach implants, even at the loose bone. So we are quite behind the schedule, but I need to finish these presentations. So I'd like to share one clinical case, which I did with the live surgery in Seoul, Korea, in May. The patient has hopeless maxillary anterior incisors. So we plan to extract these tooth and do live surgery, immediate implant placement, and we place the customized abutment and the final restoration at the same time. So the clinical situation was like that, and with the help of Artigate, we made the surgical stent and the customized abutment, PMMA temporary crowns, like this. And this is video I did with live surgeries. Tooth was extracted, as you see from many cases, and the surgical stent is very simple and easy to apply. And the drill sequence was already recommended with the Any-Reach, with the surgical stent. So as Dr. Lee said, and you can adjust the drilling sequence according to the bone density. So in this case, I placed a 4.5 millimeter diameter of implants, and I made a drilling up to 3.3 only. And the initial stability was checked with ISQ machine. So it was 73 from mandible, from lateral side, and the 72 from lingual side. Even it was placed into immediate extraction socket. And with the connection of a copper screw, the bone graft material was placed into the void of extraction socket defects. It's convenient to use a copper screw at this time, and after removal of the copper screw, the pre-made, the customized abutments were delivered. And this is MechTorque we recently developed, so it can ensure the adequate torque force for the tightening of abutment screw. And then this is a temporary crown. Our final goal with the Artigate and the Eureka Art project is to deliver the final restoration instead of a temporary crown. But still, so we have limitations on the, with the CBCT images. It's not very precise to make a final restorations. So we need to wait a little bit more. So it took from the extraction to the delivery of temporary crown, it took only 16 minutes. Even I explained the whole procedure on the live surgery. Okay. How can I move? Sorry. Okay. Doesn't go. Doesn't move. Okay, sorry for that. Okay, so this is immediate after surgery. So I did the sutures and finished all the procedure in 16 minutes. And this is comparison before and after surgery. So as you see, the position of implant was exactly matched with the planning, sham surgeries. So immediately after surgery, and 2 weeks later, and the final restoration was delivered like this. It's very easy, and all of our patients we like this kind of implant treatments without any period of absence of tooth. I try to summarize the equipment we need to prepare to do one-day implant procedures. Absolutely, we need CT machines. And also, we need to have AltGate softwares to design and to make a surgical stent. As Dr. Jung-Cheol Kim presented, we made a big advancement with AltGate program. So, and the CBCT plus STL5 project was almost finished already. And from this year, we put color coding, and the sterilization became possible to make a black bone design. And we started to use facial analyze to make a better plans for the planning for the better aesthetic result. And with these two important equipments, we made R2CT. This CT machine has R2 gate program inside already. It was loaded previously, so it will be more comfortable. And this R2CT has a very big FOV. It's a 16 by 14.5 with auto stitching functions. So you can see the whole face with a single shot. And also, as you see on the screen, it has outstanding 3D CBCT image. It's very clear, and you can minimize the metal artifacts, and the autofocusing function was very well developed, and the one-shot sepal function can be added according to your wish. And again, with the AltGate program inside the R2CT, you can make treatment planning, and you can do virtual surgeries, and with only a single click, you can make a surgical stent and customize abutment before surgery. And also, it is very competitive in price and excellent in service. And Enrich implant system is mandatory. It has a different behavior, different characteristics compared with other implant system. As from yesterday, we have a lot of presentations on this Enrich implant systems. And we need to have two more gadgets. So one is Mega ISQ. ISQ machine is not new. It's already cited at more than 500 literatures. We have a lot of data. But as Professor LaBanca presented yesterday, it's not strictly related with osseointegrations. But you can use this as objective guidelines. So, and MECTORQ, I think this is a must-have for all implantologists. Then we have manual torque machine, torque equipments, but this can provide very precise and very accurate torque force. You can adjust according to your wish. And because of this German motors, the torque force can be very reliable, and it can last very long. And the Mega ISQ, as I told you, this is not new, but design was made by Megagen, and the machine was made in Sweden by Ostel company. I think this is the only equipment we have now for objective guideline of implant stability. So, without this, if I didn't use these machines, I just guess the osseointegrations. But nowadays, I don't wait. Just I check 3 times, ISQ value 3 times at the placement and at the stitch out 1 week or 2 weeks later, and 2 weeks more when the soft tissue was healed almost completely. So when I check the ISQ value 3 times, and when it makes plateaus or when it shows increase, I can take impression immediately. So it shortened the treatment period, treatment time a lot. And we don't need to check several times. So usually my patient visited more than 10 times to finish single implant case. But nowadays, 5 times is enough. 5 or 6 times, I can finish all the procedures. Very easy and very reliable. This design was developed to use more comfortably, so this is very handy and easy to use. And the new machines will have one more LED on the proof. So you don't need to turn your head to check the numbers. And as a special, we are making the special smart bags for Megagen implants. And also, we need to have CAD/CAM systems. If you don't have CAD/CAM systems in your clinics, you can use our DDX platforms. Sorry. It's almost finished. Again, we made 2 interesting gadgets for this 10th International Symposium. One is Meg Cleaner, one is Meg Inject. So Meg Inject can clean the small components, especially for implant components, so without damaging the dimensions. So it has 3 steps for cleaning: so soaking, washing, and rinsing. So, as you know, the healing abutment is only for one-time use. But many of you, including me, use the healing abutment repeatedly. But many cases, the healing abutment has plaques and calculus accumulations. It is very, very difficult to take it out, almost impossible. But if you use some Meg cleaners, you will become a new one. So as you see, there is no very, very clean, and there is only one peak with the titanium. So, and then impression coping is same. Even we clean and sterilize with autoclave, so still it can have some bloods inside the screw, inside the impression coping. It's not easy to take it out. But if you use this, it will be very clean without any remaining proteins. Also, you can use this machine for the cleaning of diamond burr. Any kind of small equipment, small materials. So if you use Meg cleaner for your diamond burr, you will have a new one immediately. It takes, the whole cycle takes about 20 minutes. But important thing is, it doesn't change the dimensions. It doesn't make any scratches. So we studied the adequate vibrations, adequate turnings, adequate sterilizations. So not sterile, but this rinsing process can ensure no dust at all. The Meg Inject was developed from the request from our customers. As you know, painless anesthetics is not an option for our precious patients. And this is very handy. Unlike this is similar with Wanda systems. It has all function of Wanda system, but it was improved. The function was improved, and there is no foot pedals. So this button here, the green button, with this green button, you can control the machines. So it can be portable very easily. And this has battery, rechargeable batteries inside. And yes, your hygienist, or you can carry with the necklace.